Live Active community. It's Dr. Hasib Ahmed here with Live Active Primary Care. Today we're going to be talking about blood pressure cuffs, and why blood pressure control is very important. So let's get started. All right, guys, here are some quick facts on how to properly take your blood pressure. Okay, so no caffeine or exercise 30 minutes prior to checking. Ensure you have 5 minutes of quiet rest prior to checking. This cannot be rushed. Take your time with it. Sit with your back straight, feet flat. Left arm is on a flat surface and supported at heart level. Bottom of the cuff is above the bend of the elbow. And finally, don't take measurements over your clothes. It's always right on the skin. All right, let's get started. All right, guys, so blood pressure cuffs are better than the wrist. So these are kind of nice automated blood pressure cuffs that I do recommend. I don't recommend the wrist cuffs because I do find some abnormalities, especially if people have bigger wrists. It might be inaccurate. So the cuff is always the best. Blood pressure control is very important because it affects not only our heart, it can cause congestive heart failure, it can cause strokes, but it can also cause peripheral vascular disease. It also can cause kidney disease, ending up in hemodialysis in very severe cases. It can also affect our eyes. When we use an ophthalmoscope to look into your eyes, we can actually look at the arteries. And if we see something called AV nicking, or we kind of see that they're getting really tiny and small, we can actually see high blood pressure in the eyes. It can also cause some ruptures in the eyes. And so blood pressure goal should be less than 130 over 80. Ideally, we want it to be less than 120 over 80. So those are very important things. There's a lot of causes for high blood pressure. We want to make sure we rule out things that are causing your high blood pressure, secondary causes. So we have to look at your adrenal glands, look at your kidneys, look at the overall picture. Sometimes even underlying anxiety and stress itself causes high blood pressure. So, and a high sodium diet. So nutrition is very important. So it's a very comprehensive topic. It's not something that a pill or one-time visit can treat your high blood pressure. This is an ongoing process. It's reversible as well. If you're obese, or if you lose weight, you can certainly reverse this diagnosis of high blood pressure. So get with your doctor, talk about your blood pressure, and if you don't have high blood pressure, understand that there's ways to prevent it. It's an ongoing conversation, so please establish care with a good primary care physician to assure that high blood pressure is not a future health issue for you. So get out there, live active. I hope this was very useful, and we'll see you at the next video. Please like and subscribe our channel. We really appreciate that. Take care. God bless.